Hi everyone, I'm Esther
I'm Suzanne,
and we are breast surgeons from Solis. So today we're going to talk about a topic that is literally close to every woman's heart, and that's what's a mastectomy? Have you ever asked yourself what's a mastectomy and what does the public think of the word mastectomy?
Yeah, a lot of patients ask me the same question as well. So why not let's just go to the street and ask the people.
It's like a surgery that removes your whole breast.
I have no idea what's that.
It's like a removal of breast, if I'm not wrong. Like to cut out something when like people have cancerous cell in their breast. I think so. Yeah.
Mastectomy, I think it is just removing the breast. I've heard about it.
So I'm not very sure.
Not too sure. I just know it's a surgical procedure.
I don't know the real thing about it, but I just know that it's like removing the breast entirely.
Oh, that's interesting. So Esther, do you have anything that you would like to tell us about mastectomy?
Okay, very simply, drum roll please, but no prizes for guessing. A mastectomy is simply the removal of the whole breast. So this is usually done when the breast cancer is rather extensive. It involves more than one part of the breast, and therefore it's literally not possible to just take out part of the breast. So this is a surgery that's been done for decades and decades, many years, and it's been shown to be the safe, gold standard surgery. And however, recently there have been a lot of women who are doing mastectomies even when they don't have breast cancer. So usually these women have a very strong family history of breast cancer, and they have actually taken a test, and they find that they have a gene that is abnormal, predisposing them to a very high risk of breast cancer at some point in their life. So they decided to take out the whole breast. I think that's wise.
Actually, mastectomy can be generally divided into 3 types. The first one, I think most popular or the most well-known is the simple mastectomy. Why is it called simple mastectomy? It's not because that it is easy to do. It's just because it is not followed by plastic surgery whereby we actually reconstruct the breast. So after removing of the breast with a substantial amount of skin overlying it, we will actually close the skin and the patient will be left with a flat chest wall.
Yeah, but that's really quite emotional, traumatizing for the patient, especially if they're young. You know, I've seen patients who are just newlyweds, and that would be something that is shocking, and they might not even want to go for treatment.
I definitely agree with that. So I even think that having a reconstruction is the right of every breast cancer patient. So with the more and more popularity of breast reconstruction, we now have 2 different types of mastectomy which will be followed by reconstruction of the breast. So the first type will be a skin-sparing mastectomy. So what is a skin-sparing mastectomy? It is a mastectomy whereby we have to excise the nipple and maybe a small amount of skin over the tumor. This mainly happens when the breast cancer actually eats into the nipple or it causes nipple discharge. Yeah, but as you know, that nipple is actually a very important part of the breast. To me, I feel that it's the soul of the breast. So with this need, we actually invent a new type of mastectomy called nipple-sparing mastectomy, whereby we actually just remove the entire breast, but we keep the whole envelope of the breast intact, including the nipple. So after that, we reconstruct, we make a new breast to fill in the gap, and the cosmetic outcome is fantastic.
Right, so meaning that instead of taking lots of skin and leaving the breast flat, patients now have a choice to take the inside of the breast, which is what that matters, and leave all the skin, including the nipple, or just take the nipple if the nipple is involved. But that reminds me of an analogy that you commonly tell patients that I've come to hear about, which is like the
Yeah, I think 小笼包 is a very popular dish in Singapore. Everybody likes to eat 小笼包, and I think we all have a particular way of eating it. Is that we make a small bite and we suck out all the soup, and then we eat out the interior. So that is the same for a nipple-sparing mastectomy. We make a small cut, we take out the whole breast in entirety, and then we let the plastic surgeon make a new one.
That's ingenious. Of course, I feel scars are really important because ultimately this patient is already rather affected by the diagnosis of cancer. So if we're able to offer a treatment that minimizes the scar as a reminder of what they have, I think that's very important. So as long as we're able to place the scars in carefully hidden areas, or what we call inconspicuous areas, I think we would have been able to do the job better in terms of treating the patient, but at the same time not reminding them that they have to go through this difficult part of their journey. And I think it helps them with their recovery. And moreover, nowadays, our breast cancer patients, they're surviving longer and longer.
And we have so many young breast cancer patients.
Exactly. So if they're surviving longer and longer, they probably do not need to be reminded of the difficult part of the journey that they have to go through. And I think this is what we can offer to our patients.
Totally. I think scar may not mean everything, but if we can do the job equally good with a small scar, why not?
Exactly.
Yes, I think I heard about it before, but I'm not sure about the details.
Yeah, keyhole surgery is like a microsurgery.
No, I've not heard of keyhole surgeries before. I would like to know more about it.
Actually, I have not really heard of keyhole surgery. I only heard of mastectomy.
I think the surgery needs like additional machines or equipment for the surgery to be done. Yeah.
It's like remove pus kind of keyhole surgery.
I think from what I heard that keyhole surgery will have smaller scars and like faster recovery time. Then I think will be like maybe more expensive.
Esther, do you have a lot of patients ask you about keyhole surgery? I think it's getting more and more popular. What do you think are the benefits of keyhole surgery?
Yes, keyhole surgery has been around for a long time, as even from the time when I was a trainee, and that
That's
was
not very long ago.
That was a very long time ago, but you can guess at the end of this podcast. So, keyhole surgery has been around for a long time, but yet it keeps getting better, and more surgeries are getting done by the keyhole method, or what we call laparoscopic method, simply because of all the benefits. As we said, it is both beneficial for the patients as well as for the surgeons. So for the patients, it gets the job done safely because the surgeons are able to see better, and the patients usually recover faster from the surgery through smaller scars, and they are able to go home earlier. So it's got to do with the recovery. But on the other hand, for the surgeons, because they are putting in a camera system into the area where they are doing the surgery at, and they are able to have a very good visualization of the entire area, and they would take what they need to take and avoid the important structures, and therefore avoiding injuries. By doing so, the entire surgery is safer, and at the same time, less blood loss, and the patient also experiences less pain, and therefore they go home earlier. So, keyhole surgery is getting more and more popular in the various organs from the head downwards. Okay, so anything like thyroid surgeries, lung surgeries, the most famous gallbladder surgeries, appendix removal, gynecological procedures like removing the womb can all be done under keyhole approach. So I believe that it is actually an approach that is very versatile and very, very useful for both patients as well as the surgeons.
Since that there are so much of benefit of using the laparoscopic instrument, it has already come to breast, and it is commonplace for us to do a keyhole mastectomy. So in keyhole mastectomy, what we do is that we usually place an incision about 4 to 5 centimeter at the lateral outer part of the chest, and through that 4 to 5 centimeter incision, we dissect the breast from the skin, and then we can create a workspace whereby allow us to put in a camera to allow us to have better visualization, and also we can slowly peel the breast from the skin. You can see each blood vessel clearly, and so to avoid much bleeding. And for a breast surgeon that has tried keyhole mastectomy, and I think Esther definitely agree with me that after a keyhole mastectomy, we also don't feel the back pain and the neck pain so much so as the conventional mastectomy, because we are allowed to actually do the surgery standing upright and not crouching over anymore. But I think in conventionally, this method is used for smaller breast patient. But I think with more training, and after we have mounted the surgical curve, the training curve, we are actually able to even do this surgery for patients with a larger orthotic breast. But of course, this comes with training. Yeah.
That's right. I find that even though I might be loving this procedure, my plastic surgeons, or rather some plastic surgeons, are not loving it yet, because they will find, oh, the hole is too small, they can't squeeze the flap in there, they can't see well, or the implant just doesn't fit well, and therefore the plastic surgeons end up taking longer. I think that is the downside at the moment, but I do believe at the rate that laparoscopic procedures are actually gaining in popularity from the head downwards, I believe it will reach the plastic surgeons soon. They will probably be able to do a keyhole reconstruction.
I totally agree. Actually, it is being done quite standard in other countries, such as in Korea and also in Japan, where I learned this technique as well. So I think that it takes a coordination between the groups, and I think not long from now, we'll be able to build a team that are comfortable both in the mastectomy and the reconstruction parts of the
so
surgery.
nobody struggles.
Totally.
I do agree that there will be increased costs. It is a fraction. I don't think it is a lot more. But I always reason it out with the patient. If this degree of increased cost reduces the chance of post-operative complications that can lead to a longer hospitalization stay and therefore their recovery, I think it's worth it.
I also think so. Yeah. If you ask me, actually, I will also choose this because I think there are studies which actually shows that the risk of losing a nipple or the risk of losing total sensation of the nipple can be reduced with this keyhole mastectomy as well.
Yes.
Actually, now we have an increasing number of patients that actually come to our clinic and inquire about this procedure. And I think it's very valid because there is increasing awareness among the breast cancer patient. But it's not only among the patients, we do have increasing interest among the doctors as well. So we do have many conferences and workshops training breast surgeons to perform this breast mastectomy, keyhole mastectomy, both in Europe and also all over Asia. So I think it is definitely gaining interest and is gaining momentum as well.
I think it's still important, which is actually the reason for this podcast. It's still important for the patients to know that perhaps not everybody will be suitable for keyhole mastectomy, and especially also for us doctors to constantly upgrade our skills and to be familiar with the approach before offering it to our patients.
I cannot agree with you more. So there are people who actually ask, why do you guys have to do all these, learn so many new techniques and such, which may not be suitable for every patient? But my answer is always, I think I have to equip myself and wait till the day that I meet the correct patient, I will be able to offer the best solution for her.
Yeah, exactly right. So we have to do what we're supposed to do. We should be responsible to be equipped to offer the right surgery for the right patient.
Totally.
Right. And of course, I think for the patients out there, if you're unsure if you might be a suitable candidate for keyhole mastectomy, please ask your doctor, please ask your surgeon before going into a procedure like that.
Yeah, I think a discussion between you and the doctors are very, very important.
Yes. And not forgetting the plastic surgeons.
Yeah, of course. Thank you everyone for tuning in. If you find this video useful and you like it, please like and share.
And super like. There are also articles on the website. Please go check it out and leave us a review if you'd like to find out more. And that's all we have today. So bye-bye.
Bye!